Good Saturday morning, everyone. Today on Perspectives, we hear how we can help prevent and end homelessness on the Gulf Coast. We must start first, though, by saying that the experts are saying that homelessness results from a complex series of circumstances that lead to an individual, a couple, or a family having to make decisions, choosing between food, shelter, and other basic needs. 600,000 homeless are on the streets of the U.S. daily. Now, Alabama is not in the top tier of states with the highest number of homeless. National sources say that we're roughly 28th in the nation. Now, that's less than 1% of our population, but we're still talking about more than 6,000 people, children, women, and men who are homeless. Poverty and a growing shortage of affordable rental housing are two of the main reasons for homelessness. Housing First, Inc., though, serves Mobile and Baldwin County, and their approach is a homeless person must first be able to access a decent, safe place to live before you can change their situation. Housing First partners with medical and mental health organizations to provide services with enhanced value and new hope to those experiencing homelessness. Housing First also has a street outreach team that they visit area encampments, engage with the homeless residents, offering them supplies and services. It's their three-pronged approach, teaming up with Franklin Primary Health and AltaPoint. Our guest this morning is Derek Boulware. He's the Chief Executive Officer of Housing First, Inc., an organization devoted to helping end homelessness in our community. Well, after a quick break this morning, Perspectives continues with the Housing First, Inc. story. Their mission, once again, ending homelessness in Southwest Alabama. Special guest is Derek Boulware. He is the CEO of Housing First, and it's a time to talk about how we help the homeless community here along the Gulf Coast. And I love your mission statement. It says to end homelessness in Southwest Alabama. Tell us, when you share with people about Housing First, how do you give them that information? Because when you hear the name, you're not necessarily thinking that this is what you do, but right. Tell us, how do you flip that for them?
It's interesting. The name can be a little misleading, Housing First. It is really about the concept of how do you address homelessness. And the way we address it is that housing the individual first, and then once you have them stabilized, then you can be then you're able to move them into areas that will help them become more self-sufficient, job opportunities, training, but not having that stable home to go back to at night, get ready for your next day. The idea that you could be successful is really almost unlikely, highly unlikely. So Housing First, it's really the name derived from a concept of how do you address homelessness.
How old is the concept? Because I've seen some things where it's been around for a while, but maybe not as broad in the U.S. as it should be.
Locally, Housing First was really established in the early 1990s here in Mobile. It was incorporated in, I think, 96, 97, but the concept was adopted by the Department of Housing and Urban Development years ago nationwide. And the concept is called Housing First. So we took a name from a concept. These are my forebears in their wisdom, but it really does allow us to link up a concept with an actual practice.
I was looking at some of the information, and you have some core principles which include that. You want to talk about a couple of those?
Yeah, absolutely. So, number one, it is the idea of establishing a stable environment and then moving them through case management into those supportive services, like I said before, opportunities for education, development. If it's a program that, say for instance, is there designed for veterans, we have a program that is exclusively for veterans, then we're able to link them up with veteran services through the VA. Often our referrals come from the Veterans Administration. Now lately we have a new value that we've been able to bring to that program, and that's to provide direct legal assistance. And it's legal assistance that would reduce barriers to our veterans in establishing permanent residence and developing themselves into, as I said before, a more self-sufficient experience.
Getting people back on their feet.
That's right.
Now, we just came out of an interesting 2-year period. how did things work for Housing First, and how severe was it in serving the needs of the homeless community during that time, with COVID being such a major game changer for not just us locally, but the state, the country, the world?
Yeah, Eric, I'm glad you asked that. You know, it was a challenge. It was a challenge for everybody, and it was a challenge in our service field as well. We did it through interesting tactics, going to a lot of telephone communication, anything we can do to provide that separation for the safety of our clients and our staff. But what we also found around locally, due to a lot of new funding that came in due to COVID, we did not have as dramatic an increase in homelessness as we feared in the beginning. Of course, there were a lot of factors that played into that. There was the moratorium on evictions. That helped. And then the federal aid to those that were not able to afford their living because they had lost their jobs. And so there was a lot of funding that came in for homeless prevention, keeping someone from becoming homeless. So because of that, we did not see a dramatic long-term uptick in the number of homeless. And, you know, we were fortunate, and it was fortunate that our community was able to be on the receiving end of those opportunities. Now, we don't expect that to last forever. And so we go back to, and we are preparing to go back to pre-COVID type funding for this. And this is something interesting that a lot of people don't realize. Nationwide, the average is around 80% of all funding for homelessness is on the federal level. It's a very small portion nationally that is actually from the local level. We want to change that. We want to encourage the community to see that this is a community problem. The federal government can't possibly know what we know. And so they can assist us just to some point, but then it's going to require the local community, and we have great partners here locally, through the United Way and through other agencies that support this cause. But it's always going to take more for us to truly realize our mission to end homelessness. It's going to take the community to do it.
Yeah, team effort. Do you think most people realize that that's where you're getting all your funding primarily from, that it's not something that's happening? Because you do see on news programs and PBS, you see programs about other successful programs that have targeted a certain portion of how do we help the homeless.
Sure.
And so, you know, you hear the mixture of local and federal and state taking place there. So I guess we're assuming that you're getting this.
Yeah, and when you talk about specific areas, and I mentioned earlier the veterans, now that's really an area that the Veterans Administration have dedicated a lot of funding nationwide to. So we've been able to improve nationwide the number of homeless veterans that are on the street. We have not ended it. We have not completely resolved that situation. There are still homeless veterans on the street, but the funding for it has been put at such a level that here locally, if you are a veteran and you do have an honorable or other than honorable discharge, at Housing First, we can work with you and help you to find a job, get you into a permanent apartment or house, and provide those. Now, that doesn't exist for the general population of homeless. That's why here in Mobile, like a lot of cities, we have a priority ranking. We have to do that. We have to prioritize people based on their need. The greatest need, they then are going to be the ones that we're going to try to help first, because we have a need that's so great and we have a resource that is not nearly great enough to support the need. That's why referral ranking is so important. So we categorize and we class the need with chronically homeless people being at the top. Now, this was a ranking that was established locally by the community. How do you want to provide services in the most efficient way possible? So chronically homeless, you've been on the street for over a year. The second one would be youth. Obviously, we want to prioritize youth between 18 and 24. And then families with children, number 3. Individuals that are disabled, they come in at number 4, and number 5 would be people fleeing domestic violence. and disabled. I should say. So you have this category.
Right.
And it doesn't answer the question for everybody, because there are really people that we would like to help. They could be successful if we had them in a program. It's just that the funds are not enough to serve everybody.
Right.
And if we had greater funding, a lot more people could be assisted.
So that's where it comes into finding a way to include your local, your state, as well, of course, as what's happening from a federal standpoint. We're going to take a break, Derek, and when we come back, we're going to talk more about Housing First and some of the good things that are happening right now with the funding you do have available to make a difference in the community.
Sounds good.
All right, our conversations with Derek Boulware continues right after this quick break. To Perspectives. This morning, our guest, Derek Boulware. He is the CEO of Housing First, and we're talking about who Housing First serves so that people understand when they hear that name that this is the guy to call to make a difference in the community. The numbers they're saying now, nearly 800,000 homeless daily on the streets of America. What are our numbers like here in this area, Southwest Alabama?
I can tell you, just in the 2021 year at Housing First, we saw right at 3,000 individuals that presented themselves to us or that we had contacted through our street outreach program. Now, the folks that we are able to help is based off of HUD's definition of homelessness. You're literally homeless. You are in imminent risk of becoming homeless, so you have an eviction notice. Or third, you're fleeing domestic violence. Literally homeless, someone who is living somewhere that's not meant for a person to live. They're living in their car, they're living outside, they may be living in a shelter, and HUD says, all right, that's what the definition of homeless is for our purposes. It doesn't capture everybody.
Right.
Someone else may have a different definition, and that's absolutely fine. I know the school system, they track a different definition. It's just that for the Housing and Urban Development, they track it based on that very specific definition. So last year at Housing First, we operate what's called the Coordinated Entry System, Eric, for Mobile and Baldwin County, meaning that we are a single source for accessing resources if you're homeless. You come to Housing First, or we go to you, we will do an analysis on you, we'll determine what your needs are, and we'll have you as a priority. You'll be placed into that priority, and then from that, we're able to refer out you to other services that might be able to assist you, other programs that are out there, agencies that can help you. And while you're in that waiting list, there are other services short of housing that we can also refer you to, a lot of mainstream services. So Housing First operates as that coordinated entry. We're also it's called HMIS, but it's a software system that we track all the data of homelessness in Mobile and Baldwin County. We are the single source of data that the federal government relies on when they want to know what homelessness looks like in Mobile. So if they want to know the numbers, the demographics, we provide all that all year long in the form of reports. And so last year, as I said before, we met with right at 3,000 individuals that met the definition of homelessness according to HUD. We were able to house right at 420 of those people just through programs that Housing First administers. But if you take the collective, the community collective, through referrals, we were able to house 770 people. That's reaching outside of Housing First. Yeah, and so this is what goes back to what we talked about a little bit ago, which is it takes a community. And it truly does. We're working on that right now. We can always improve that. And I think the way we improve it is getting more people knowledgeable about what services are currently available, and then we know the gaps that are out there. And from that, we can address those.
When we look at the picture that has been painted in the past, we were told that a lot of people were, say, traveling, and the tunnels and the bridge was sort of a dead end for people to be able to continue their movement to, I assume, Florida, since that's on the other side, or Baldwin County, more, say, temperate areas, I guess, for the area if you're staying outside, unfortunately. And we were sort of the area that the numbers were coming to as they were trying to head east. Is that still an issue, or just now, because of how things have changed with the economy and COVID, are people here in our area now becoming the homeless?
Yeah, I'm glad you brought that up. The real estate market has played a role. Now, from a data standpoint, I can tell you the point in time count, which is another requirement of the federal government, which we administer. It would tell you over the last 17 years, our average on the point in time count is staying pretty much right where it was over a 17-year average. This past year, on that one day, we counted right at 585 people between both counties. Now, that's just about 6% below the 17-year average. All that tells us is that, are there trends nationwide? Because we do this the same way all the other cities do it across the country. Now, I can tell you from just what we can see more in places like Baldwin County, for instance, that we had not seen. I've been a resident of that county for over 20 years myself, and so we're seeing more with our eyes. The data would not support what we're seeing, but sometimes that can be a lagging indicator. So it may be in time that we will see a larger number through the data that we collect. And we're doing what we can to provide services and to know what we're providing services in our outreach program by putting people from Housing First into the field every day on both sides of the bay so that we can help people that need help and have eyes on the ground so that we know where to count and where to look.
I guess that gets into, again, that qualifying system that you mentioned, because we may see somebody and we may see them on a regular basis and we're wondering, well, why hasn't this place or Housing First,
sure,
with the different agencies that we know of and we expect for them to be helping, why haven't they helped that person yet? But that sort of plays into what the needs are and where they are. And
that's exactly right. And we hear that a lot, and it's certainly justified to feel that way. Why haven't you helped this person? This is a very good person. They could be successful if they were given that opportunity. It's because most of our funding is program related. It's a program that was set up, let's say, for instance, for families with children, or it's a program for veterans, or it's a program for someone with disabilities or that's chronically homeless. The area that is not covered most often in homelessness is the individual adult, the unaccompanied adult. Those are the people, and I mentioned earlier, the majority of funding for this conversation is coming from the federal level. The federal government is not, by and large, funding that segment of the homeless population. They're funding the ones that we talked about. And so those are the ones that we prioritize because the program is there. So if you're an individual without a child or you're not disabled, there more than likely will not be funding in this area for you. So these are areas that we know the gaps exist.
Right.
Yeah.
Right. Well, Derek, we've got about a couple of minutes left. Is there an area that you want to tap on and share about that is really making a difference right now that you're very pleased with?
I am pleased with a lot of the opportunities that were brought to Mobile lately unfortunately, due to COVID, but the resources that were brought in, a lot of the homeless prevention funding, we can help people not become homeless. We're currently administering funds through the city of Mobile and through the state of Alabama. Those were great opportunities to avoid rising numbers of homeless. But I would say right now, outside of the normal programs that we operate, the coordinated entry, the data collection, is what we're able to do for veterans. Very excited to talk about the legal assistance that we can provide. I know you're a veteran, and it's close to your heart, and the veteran community is close to everyone's heart. So now, if you come to Housing First and you're a veteran, we can assist you with your legal needs, on top of assisting you with permanent housing, job placement, training. A lot of people don't realize they need an attorney. They don't realize, if I had someone that could help me navigate through the court system, then I would be able to move on with my life. But a lot of things keep you from advancing in life if you've got a warrant that's hanging over your head, or anything that might be a barrier to your permanent living situation. So that would be an area. So if you know a veteran, please, and they're homeless, please send them to us. Let us talk to them. We'll go to them if they can't get to us. But we want the opportunity to bring these services to a group that certainly deserves our support as a community. But again, again, it is a community issue, and we encourage the whole community to get involved with Housing First.
Part of this. Two quick questions.
Yes.
Will we ever be like Japan and Finland?
Well, can you be more specific?
Well, they're considered the countries where the least amount of homeless, and Finland supposedly is free of homeless people in their country.
Right. Well, I don't know. I do know that the way that we address homelessness, and I think the most effective way, is to house people that are homeless, and then they're not homeless. I think that's the way that we do it in the most efficient way, giving people an opportunity to have a successful life with the permanence of a residence.
That sounds like Housing First.
I think
we're
it
going to
does.
wrap on that, but thank you so much for being here today and sharing, and we look forward to that community growing to help here in our area.
Thank you, Eric.
And if you'd like to know more about Housing First, you can call them or for a face-to-face visit, or check them out as well excuse me, on their webpage. The Housing First office is located at 279B North Washington. That's Avenue in Mobile. The main office number is there as well, 251-450-3345. And their web address is hfal.org. Now, you can also check out their social media pages like Facebook, Twitter, and Instagram. Well, please join us here next Saturday morning at 9 a.m. again for Perspectives as we discuss important issues and seek solutions. Remember now, if you missed the Saturday broadcast, you can always find it on fox10tv.com and as well as our Fox 10 app or on our YouTube page as well. Well, I'm Eric Reynolds. We thank you so much for joining us on this Saturday morning. Until next time, you take care.
Thanks for watching Fox 10 News. Watch us live wherever you are, on our mobile, our streaming news app, and you can also watch us on Roku, Apple TV, and Fire TV.